anxiety disorder, IAD, also known as hypochondriasis, is a mental health condition characterized by excessive worry about having or developing a serious illness. Individuals with IAD often misinterpret normally bodily sensation as signs of severe disease, which leads to distress and frequent health checks or medical visits. IAD can cause significant disruption to a person's daily life, affecting their personal, social, and occupational functioning. The prevalence of illness anxiety disorder is estimated to be around 1 to 5% in the general population. It is relatively equal among men and women, but women may present more frequently in clinical settings. The disorder often begins in early adulthood but can develop at any age. It is also common among individuals with a history of significant stress or trauma. The data above shows the percentage of adults in the United States reporting symptoms of anxiety or depressive disorder in February 2023, broken down by age groups, and the younger adults, particularly those aged 18 to 24, are most affected by anxiety or depression, while older adults 65 plus report the least symptoms. This data underscores the need for mental health support, especially among younger age groups. The signs of illness anxiety disorder, according to the DSM-5-TR, preoccupation with having or acquiring a serious illness. Number two, somatic symptoms are either not present or mild. If a medical condition is present, the preoccupation is clearly excessive. The number three, there is a high level of anxiety about health and the individual is easily alarmed about their health status. Number four, the individual engage in excessive health-related behaviors, for example, repeatedly checking their body for signs of illness or exhibits maladaptive avoidance, for example, avoiding doctors or visiting the hospitals. Furthermore, the preoccupation has persisted for at least 6 months, but the specific illness fear may change over time. The health-related preoccupation is not better explained by another mental disorder. For example, generalized anxiety disorder, panic disorder, or obsessive-compulsive disorder. While the exact causes of illness anxiety disorder are not fully understood, it is believed to be influenced by a combination of biological, psychological, and environmental factors. Here are some of the key contributing elements such as genetic predisposition. Family history of anxiety disorders may increase the risk of developing illness anxiety disorders. Individuals with close relatives who have anxiety or mood disorders are more likely to exhibit similar tendencies. Inherited traits related to heightened anxiety and sensitivity to bodily symptoms may play a role. Past trauma or significant stress also contributing to this issue, such as personal history of illness. Having experienced a serious illness in the past can heighten the perception of vulnerability and increase fears about future health problems. Furthermore, illness of a close relative, witnessing the suffering or death of a loved one due to illness can lead to heightened fears and anxiety about developing similar condition. Exposure to stressful life events such as major losses, accidents, or traumatic experiences can exacerbate health-related worries, especially if the event was related to physical illness. And the next is cognitive factors. Individuals with illness anxiety disorder tend to misinterpret normal bodily sensation, for example, a headache or stomach pain, as signs of a severe illness. This pattern of thinking leads them to magnify minor symptoms and overlook rational explanations. People with illness anxiety disorder may have a heightened sensitivity to physical sensation, paying excessive attention to normal bodily function that most people will ignore. For example, heartbeat, minor muscle twitches, and many more. Also, health anxiety and cognitive distortion also contribute to this issue, which is many individuals with illness anxiety disorder have maladaptive thought patterns, such as overgeneralization, for example, if I feel pain, it must be cancer, or confirmation bias, focusing only on evidence that supports their fear of illness while ignoring evidence to the contrary. And the next factor is environmental and socio-cultural factors, exposure to health-related information. With the rise of the internet and social media, individuals can easily access a vast amount of medical information. Excessive online searching, also can call as cyberchondria, can intensify fears and perpetuate the cycle of anxiety and learn behavior. Children who observe their parents being overly concerned about health may adopt similar behaviors and attitudes, leading to increased health related worries in adulthood. Furthermore, is about personality traits such as neuroticism and perfectionism. Individuals who are prone to neuroticism, a tendency to experience negative emotions, or who have perfectionistic tendency, may be more vulnerable to developing illness anxiety disorder. They may set unrealistically high standards for their health and become overly distressed when they perceive something as wrong. Heightened sense of vulnerability also. For example, some people have a strong internal belief that they are more prone to illness or that their body is weak, making them more susceptible to health related anxieties. Overall, illness anxiety disorder is a complex interplay of these factors, and its development may differ from person to person. Addressing these contributing elements through a tailored therapeutic approach is essential for effective treatment. Effective intervention for illness anxiety disorder typically involve a combination of psychotherapy and in some cases medication, such as cognitive behavior therapy CBT. The most effective form of therapy for illness anxiety disorder, it helps individuals challenge and reframe their irrational thoughts about illness and reduce anxiety provoking behaviors. And the second is exposure therapy, gradually exposing patients to their fear health situation without allowing them to engage in safety behaviors like excessive checking can help decrease anxiety over time. Mindfulness and stress reduction techniques is also an effective intervention. Practices such as mindfulness, meditation, and relaxation training can help patients focus on the present moment and reduce the urge to excessively monitor bodily sensation. Moreover, through education and psychoeducation, for example, providing accurate health information and addressing misconception can be beneficial for reducing anxiety. Last but not least, excessive worry about health can be as debilitating as the illness itself. If your fears about sickness are overwhelming, you are not alone. Illness anxiety disorder is a recognized condition that can be treated effectively with professional support. Let's work together to break the stigma around mental health and provide a supportive environment for those in need. Seeking help is a step towards reclaiming your peace of mind. If you or someone you know struggle with intense fears about illness, help them. Seek compassionate care. Recognizing and treating illness anxiety disorder can lead to a healthier, more balanced life.